as a result of foreign competition, our gross profit margins deteriorated. We had to watch every penny of overhead.
Every penny, every half penny on this product.
And the one area that was so confounding was healthcare costs.
Every employer I know, they dread the next hike in their insurance rates.
The current costs of the system are becoming intolerable.
Why are we creating an extra hurdle for business? It's tough enough out there.
We looked at opening up a U.S. operation. If I had to increase my costs by over $1 million because of insurance coverage costs, that alone would probably drive me into bankruptcy.
Why are we making it harder for people to buy goods and services to the American public while employing people and providing tax revenues?
Healthcare costs are going up 2 to 2.5% above the projected gross domestic product. So it is running away from us.
Health insurance is a really complex system.
I cannot read my insurance policy. I don't understand it. The variation in what hospitals are getting paid was more dramatic than we thought. How are the prices set? I'll wager you have no idea.
Nobody really knows what it costs, and what healthcare systems have learned is that they can charge whatever they want.
You see, there's no accountability. The buck doesn't stop anywhere.
Our current broken healthcare system is the most rationed healthcare system in the world. That's why a third of Americans don't get the healthcare they need.
Pity the poor company that's more labor intensive than us. They are going to suffer dramatically. And if they are having bad years, if they're on the verge of collapse, this is going to push them over.
We are undermining our capacity to function, let alone compete as a society, because of the rising costs of healthcare.
If I told you that every one of your employees could get the health care they need, guaranteed, that your costs would go down, everyone would pay less and get more, you might be skeptical.
Just imagine what it would mean for this country if we could cut our health care bill by 25%. Imagine what it would mean for our business community not to have this albatross around their neck. It would be extraordinary.
And now, let's look at some numbers. Let's see what a no-hassles healthcare system looks like. Did you know that the U.S. healthcare bill flew past $3 trillion last year? The result is that we have the most expensive healthcare in the industrialized world. 600,000 American families, affecting 1.4 million people, file for medical bankruptcy each year. In the United States, healthcare costs per capita are almost twice that of the next Western country, and are almost equal to that of the next two countries combined. Over 60% of all household bankruptcies in the United States are due to medical bills. Our national healthcare bill will climb from over $3 trillion to over $5 trillion in the next 7 years. Our healthcare costs have risen over 800% since 1960, while our gross domestic product has risen only 100%. The World Health Organization ranks the United States number 37, just behind Costa Rica and just ahead of Cuba. The three main problems are that insurance companies have not been able to control healthcare costs, 21% of drug prescriptions are not filled because Americans cannot afford to pay for them, and we spend more on healthcare than any other country, but get far less in return. The fix is simple. A single-payer system could operate without high deductibles and copays. A single-payer system would allow us to negotiate with pharmaceutical companies, just like most countries in the world, saving over $150 billion a year. A single-payer system will drastically reduce administrative costs. A single-payer system will eliminate the complexity of the private insurance system, reducing U.S. healthcare costs by more than $500 billion a year. A single-payer system will allow physicians and patients to determine appropriate care, not insurance companies. In 2015, the federal budget placed the cost of health care almost a third higher than the cost of national defense. Taiwan's healthcare system has administrative expenses of 1.6%, while the U.S. has administrative expenses of 30 to 35%, over 18 times higher. The United States spends 18% of gross domestic product on healthcare, compared to less than 12% for France, Germany, Canada, and Japan. Between 2002 and 2014, average family healthcare costs under employer-sponsored plans increased 250% and another 6.4% in 2015. And working together, we can fix it.
I set out to answer a question that's pretty important for Americans, and that is, how come all the other advanced, industrialized, free market democracies, countries just like us, manage to provide health care for everybody of high quality and still spend half as much as we do? How do they do that? And I went around the world trying to figure that out, and you know what? I think I got it. I think I nailed this in the book. But along the way, I figured out there was another question that's frankly just as important, and that is, why do they do it? Why would a country commit to provide health care for all its people? And if you think about that one for about 5 minutes, it leads to another pretty obvious question. Why doesn't the world's richest country provide health care for everybody who needs it? How come we've never made this commitment? And in the book, as I said, I deal with those three questions. I think I get to the how they do it. I think I figured out why the other countries do it. I still can't figure out why we don't do it. I really struggle with that in the book. I call this the National Health Insurance Model, the NHI model. And in this system, the providers, the docs, the hospitals, the labs are private, for profit, and the payer is government. The insurance system is government, and the paradigm case here is Canada. Canada has a system where everybody pays a premium to the provincial government, and you go to the doctor for free. The bill's paid for by the system. And guess what they call it? They invented this in 1944, and you know what they call it? Medicare. Medicare. And when Lyndon Johnson decided in 1965 to provide government health insurance to all American seniors, he took the model and the name from Canada. Private providers and public payers. And this is a good system. This is used in Canada, in Australia, Taiwan, South Korea, a lot of newly rich countries that have just instituted healthcare systems in the last 10 years or so have adopted the Canadian model, and Mexico is doing it as of January, and I think theirs is going to be Canadian model too. And here's what he said. He said, yes, we do keep people waiting for non-emergency care, but you got to know something about Canadians. He says, for Canadians, we don't mind waiting that much as long as the rich Canadian and the poor Canadian have to wait about the same amount of time. Now, there is a national ethic of health care in that one sentence, and it's not our ethic. So I went to Switzerland and said, I'm from PBS, could I talk to your health minister? And the Swiss said, American PBS, talk to our president, you know, which I did. And I asked them, why do you have everybody in the same system? And they gave me 3 answers, and I will let you judge whether these make sense to you. First of all, it's just so much simpler and cheaper as an administrative matter if there's one set of forms and one set of rules, and many countries have one set of prices. Second, if everybody's in one system, cradle to grave, then that system has a real strong economic incentive to provide preventive health care. Public health endeavors, preventive health, it definitely reduces suffering. It extends lives. There's no doubt about that, but it's expensive. Public health is costly, and you need an incentive to spend the money. Well, in the American healthcare system, most people stay with one insurance company on average. The average is 4.8 years. That insurance company, which has to pay a profit to its investors, it would be stupid for them to waste money on keeping you healthy. By the time you get sick, you're the next guy's problem. I mean, a lot of those latent diseases won't show up till you're 66 and you're on Medicare. You're the government's problem. You with me? In the other countries, they worry about you because they're going to have you for life. And I once said to the health minister of Britain, it was TR Reid at the time, boy, I like living in your country because I feel that a whole bunch of people are working really hard to keep me healthy. And he said to me, isn't it obvious? Of course I'm going to do that. Here's what he said. He said, from the time the line turns blue on your mother's pregnancy test until the time you flatline in my hospital 90 years later, you're my patient. Of course I want to keep you healthy. You see, there's an economic incentive for preventive health. And then the third reason that they think everybody should be in the same system with the same rules is they think it's fairer. They think it's fairer if everybody has the same access to the same care at the same cost. And you know what? The number one lesson I learned traveling the world looking at healthcare systems is that fundamentally in every country, healthcare reflects a country's moral values. The design of any country's healthcare system, obviously it involves medical issues, economic questions, political questions, we're seeing that. But fundamentally, it's a moral question. Do you feel that a rich society has an obligation to provide health care to everybody who needs it? And countries that make that moral commitment then design a system like the ones I saw in Canada, in Britain, in France, Germany, Japan, that cover everybody. And if you don't make that moral commitment, if you're a country like the United States that really never even has that argument, then you may end up with a system where certain people with good insurance or a lot of money get the finest health care and the finest facilities with no waiting, and tens of millions of others never even get in the door. That's the system we've ended up with. And my fundamental argument in this book is, I thought I was writing a book about how do they do it? And I said, I think I got that. But the more important question is why? Why would a country commit to provide health care for everybody, or why haven't we? And to me, that's what we've first got to do. If we're going to fix our health care problem, we first have to resolve this moral question, decide whether or not we want to make that commitment. And I'm now going to summarize for you. I can summarize my book in one sentence. This does not give you a pass against buying the book. You know, my publisher spent a lot of money sending me around the world. But here's the point. If we Americans could find the political will to cover everybody, if we had the will, all the other countries could show us the way.